Welcome to Ladies Talking Love Season 3. To kick off our new season, our first episode is Help for Painful Sex. It's Ladies Talking Love, a community of women uncovering more joy and fulfillment in sex as we learn from experts and amazing women like you. Together, let's create a world where women's sexuality is celebrated and understood, beginning with our own. I'm your host, Ariel Finlinson. Let's talk love. The very first thing that I want to do for this episode is to dispel any type of doubt that sex should be painful. I know for me growing up and getting ready to get married, I heard so much that sex is just going to be painful your first time. And even the idea that it might just be painful. And even though you all know, or hopefully will know, I'm a huge proponent that sex is not just intercourse, but at that time of my life, when people talked about sex, the only definition I had was intercourse. And I want to dispel that myth because it is not true. If intercourse is painful, that is not normal. If it's painful, something is wrong. And your body's letting you know that something is wrong. And so you need to get help for that. It is not normal. And it's so sad to me how many of us as women have grown up hearing that intercourse is painful. And then if it is, we just think that's the way it is and that it's normal without even realizing that we need help and we can get help. So in this episode, we are going to talk about some of the reasons for painful sex and how to get help. Sara Reardon is a doctor of physical therapy and board-certified pelvic floor specialist since 2007. Sara specializes in the treatment of pelvic floor health, pregnancy, and postpartum recovery. She's the founder of The Vagina Whisperer, an online platform for pelvic floor education and exercise, and owns a private practice in her hometown of New Orleans, NOLA Pelvic Health. She is a wife and mom of 2 boys. Before jumping in, I just want to thank you all again so much for being here and for coming back for season 3 after a very long break that was not anticipated. But I'm feeling so much better now that I'm in the 2nd trimester of pregnancy, and it's been so good for me to get back into some of the things that I love. I'm still not, I would say, back to 100%, but I'm so happy to be back. And I hope that this season will bring you a lot of good information and just give you hope for the future of being able to make the world a better place for women's sexuality. But without further ado, let's talk love. I'm so excited to welcome Dr. Sara Reardon onto Ladies Talking Love today. Thanks so much for joining me, Sara.
Thanks for having me. I'm excited to be here.
This is a topic I know Sara is so passionate about with her work in pelvic floor therapy. And before we get started, can you just give our audience just a little background about why you're so passionate about this topic?
Absolutely. So I am a pelvic floor physical therapist, and some of you may know what that is and some of you may not, but as a physical therapist, I work with muscles, and I happen to work with muscles in the pelvic region, which are responsible and play a role for bladder health, bowel health, pregnancy, postpartum, and sexual health. Oftentimes people come see me in my clinic in New Orleans if they're having issues like urinary leakage or postpartum weakness or painful intercourse. And, we see folks all across the lifespan, but I would say pregnancy and postpartum is probably our most common time that we see folks because our bodies go through such a huge transformation. And I started in this field 15 years ago when I graduated from physical therapy school and just thought, 1, it's so amazing to learn more about my own body as a woman. And 2, it was really awesome to be able to help people with something they didn't know where to get help. I think we don't talk about this intimate part of our body often. We don't even know where to go to get help. It's amazing people who have experienced urinary leakage or painful intercourse, and it affects their quality of life so much that to be able to help them with that is really rewarding for me and also really kind of life-changing for them.
I love it. And if you don't follow Sara Reardon on Instagram, you totally should. She has a vulva that she wears and does like reels with. It is fantastic.
I do. I do have a vulva costume, which I love and take out occasionally for Instagram reels. My kids also think it's a hot dog costume. So that's also quite entertaining as well if you catch those videos.
Oh, I love it. And there were so many topics that we could have talked about today, but I decided that I wanted to talk with Sara just about painful sex because I feel like this is such a common issue. I wish it wasn't, but so many women go into relationships believing that sex is painful for women. And so, what are some of your thoughts, Sara, on why do you think it's such a common belief that sex is painful for women?
I think if we really start back, even from when we start talking or not talking about sexual health when we are young women, I think we go through puberty or reach puberty. And I know for myself, my mom gave me a box of tampons and a book and was like, let me know if you have questions. And that was really the extent of the conversation. And there was no conversation about this is what that means for your body, for your fertility, for your sexual health. And then when you become sexually active, these are some of the things that you want to be aware of. And so at least when I was growing up, we just weren't having these open conversations. So when we do experience a problem, painful sex or difficulty achieving an orgasm or painful orgasms, we don't even know that that's a problem because we don't even know what's normal, let alone what's abnormal or unusual. The other thing is that, again, talking about our vagina, talking about sex is an intimate topic. And so we just live in a culture and a society where we get a lot of input from media and movies and about what sexy and sex is supposed to look like. And if that doesn't look a certain way for us, we feel like there's something wrong or that we're damaged or defective. I think it's just been really amazing as a pelvic PT for people to share, for them to trust me with that information and to really be a guide for them and have them go from not being able to have intercourse once they get married to being pregnant and having a family. And those are just such huge events that it's awesome to be a part of that journey for them.
And so many things that you mentioned, orgasms being painful. I feel like that's something that a lot of us, it's like, well, if I can orgasm, this is a win. But that
Right.
things can happen with intercourse or with orgasm or after intercourse that there might be pain. So when women do experience pain, why do you think that it can be so hard for them to get help or even know where to go to get help?
To answer that kind of in two parts, Ariel, the first part is we don't know where to get help. Do I go to my primary care doctor or do I make an appointment with my OBGYN? And then even if you go tell them, they may not know where to direct you. As a pelvic floor physical therapist, again, we work with muscles. And so if you have tight, tense pelvic floor muscles, that can make penetration into the vagina painful. It can be painful with initial insertion and feel like something's hitting a wall when something tries to enter, or it can be painful deeper where it feels like somebody's pressing a tender bruise or it hurts with deeper penetration. And so both of those are experiences where your pelvic floor muscles can likely be involved. Other factors are hormones, sometimes lower estrogen levels, like when you're breastfeeding or taking birth control or going through menopause, can cause vaginal dryness. That can cause pain or discomfort. Scar tissue, if you've given birth vaginally and had a perineal tear or an episiotomy, that scar tissue can cause pain. Even a cesarean section scar tissue, that abdominal wall restriction can cause pelvic pain. So there's a lot of factors when it comes to muscles and tissues that can cause pain. And as PTs, that's really where we have the ability to help somebody relax and release those muscles, walk them step by step on how to do scar massage or muscle releases to their pelvic floor. And I kind of think about it like if you had back pain, you'd go see a PT and they'd tell you how to relax your back. This is kind of the same thing just for your vagina.
I know this is kind of hard to explain what pain may feel like, but can you try to explain what are some things that women should be looking for with intercourse or with a painful orgasm or after sex? What are some of the symptoms of like, oh, this isn't normal?
That's such a great question. And I always say, just blanket, sex should be pleasurable and enjoyable. It should not be even just tolerable, and it should never be painful. The unfortunate thing is, 1 out of every 4 women will experience pain and painful intercourse at some point in their life. And even myself, as a mom of 2, I've experienced painful intercourse. And I'm like, I know all the tools and fortunately work with a pelvic floor therapist who can also help me on my recovery. So I would say the first thing is if it's painful with insertion, if it feels dry, if it feels raw, if there's any bleeding, If it feels like something's hitting a wall and you can't get it in, that's a sign that there could be a muscle or tissue dysfunction. If there's pain deeper, if like certain positions are just more comfortable than others, if it makes you want to avoid sex, that's a signal to yourself of something's not right because this should be enjoyable. And the same thing with orgasms. If you have pain or achiness during sex or during an orgasm or afterwards, those are also signs that there could be a muscle component. Oftentimes people may go to their OBGYN and check in and say, hey, this is going on. Or you can even just go straight to a physical therapist who specializes in pelvic floor therapy and say, hey, this is what's going on. And then we can always refer you to a doctor if you need additional medical guidance as well.
Which is so helpful to know, like, okay, I can start here. And then if I need more help, they'll help refer me. And you mentioned that 1 in 4 women will experience sexual pain throughout their life. What are some of the instigators of sexual pain? Because like you said, you may not have had sexual pain and then you have a baby or an episiotomy or something. What are some of those things that can change throughout a woman's life?
Absolutely. So hormonal changes. So if you're on birth control, hormonal birth control or an IUD, those lower estrogen levels in your body can cause vaginal dryness or sensitivity, menopause, breastfeeding, also times in your life when you have lower estrogen levels. Trauma. So it could be sexual trauma. It could be just personal life trauma or emotional trauma. There have been studies that show just watching something violent on TV causes your pelvic floor muscles to tense up. And I tell people, if you kind of are driving in your car and you are sitting at a red light or sitting in the carpool line, like just check in with your pelvic floor. Are you clenching your butt? Are you clenching your jaw? I mean, our muscles hold on to tension all throughout our bodies. I get tense, tight shoulders and I get headaches. It's kind of the same thing in your pelvic floor. You can get tense, tight pelvic muscles, and that causes tension in the area, making sex uncomfortable. And then obviously another time is pregnancy and birth. You know, it's just a time where our bodies do go through such dramatic changes. And unfortunately, in the United States, we don't have a really formal postpartum recovery plan for women. So if you've had a cesarean section, if you had a perineal tear or a episiotomy, if you just had a vacuum or forceps or a traumatic birth, any of those things can contribute to muscle tension or scar tissue that can cause pain.
And I think it's so interesting you talking about the tension and how our pelvic floor should be loose and relaxed, because so much of the media and outside are like, we want tight vaginas. And we're like, no, that's exactly not what we want.
Exactly. I'm like, we want a strong vagina, but we don't necessarily want a too tight vagina. And that's what's crazy is the narrative has been Kegel, Kegel, Kegel. I mean, from when I was 17 and reading Cosmopolitan magazine to now, I'm turning 40 this year, and I still see that all over the media and even physicians saying that. And if you have a muscle that's too tight or tense, you don't want to keep tightening it. You want to make sure it's lengthened and relaxed and then strengthen it if it's weak. It's the same thing. You know, you kind of want to see what is the condition of the muscle. Is it too tense or tight, or is it actually weak and needs strengthening? But more often with painful sex, it's tight, tense muscles that need to be relaxed first.
And what can women do as they're listening? Like maybe they're not experiencing painful sex, maybe they are, but just to kind of start to notice, oh, is my pelvic floor tight? I'm not really sure. How can they start to notice that?
So check in. I mean, some of the signs that we see, because these muscles are responsible for bowel and bladder health as well. So when you pee, do you have a hard time starting your stream? Do you have to kind of push to empty it all the way? I call people power peers when they have to push or strain really hard to empty their bladder because their muscles aren't relaxing. So their stream can just flow really easily. Another one is constipation or hemorrhoids. Are you a strainer when you poop? Like you can't get it all out, or your poops are pencil thin, or you go, maybe every 2 to 3 days. Those are also signs of pelvic floor muscle tension. And then other things like tailbone pain, pain wearing jeans, abdominal pain or soreness, painful periods. All of those kind of pain diagnoses tend to elicit more tension in our muscles. Some of the things that I really encourage people to do outside of checking in is I do encourage using a lubricant. Sometimes we used to think that, I don't want my partner to think that I'm not wet but I'm like, no, use it. It's like, you know how many face creams I use?
And lotion for our hands.
And lotion for our hands and our feet. I mean, everything. So I do encourage using something that's non-irritating, not tingly, burny, glittery, smelly. If you're going to use a lubricant, it should be water soluble and paraben and glycerin free, but feel free to use a lubricant to minimize friction. Also, just before having sex, take some big, deep breaths. I think it's hard to go from the life we have of screens and kids and work, and then you carry that tension with you. So do a little bit of mindful breathing, a little bit of meditation, big, deep diaphragmatic breaths to kind of just soften your nervous system and help your muscles let go. And then I'm also a huge fan of yoga, which is all about breath work and relaxation. So if you're a person who does a lot of like high intensity strength workouts or cycling, balance that with relaxation and lengthening as well.
And how do you strengthen your pelvic floor? Because we're talking a lot about relaxing our pelvic floor, which is so important. But what are ways that your pelvic floor can be strengthened? Because it's not Kegels, even though that's what we've been told like our whole life.
Right. It's kind of like, how do you strengthen your upper body? Bicep curls are one way, but actually then you integrate that into a bunch of other exercises that you're doing. So a Kegel is a pelvic floor contraction that can be taught to strengthen your pelvic floor. But if you sit around and just do Kegels while you're at your desk or in the carpool lane, your pelvic floor is not going to be strong in the way that you want it to be. You want to really focus on two types of Kegel contractions, which are quick ones that you just squeeze, relax, and then longer hold contractions where you hold for 5 to 10 seconds that work more of the endurance of the muscle. And then you want to practice those in different positions, practice them in lying down, practice them in standing, practice them in walking. Most people don't leak urine or have weakness when they're lying down. It's when they're running, jumping. So learning to integrate that Kegel contraction into other exercises is really the key. So squats, lunges, planks, push-ups, like take that contraction and then bring that into other activities and exercise.
But not just to sit and do Kegels.
I just don't think folks are going to get the results that they want doing that. Yes.
Oh, no, that is so helpful. So in your practice, when people come in and are having sexual pain, what are some of the most common reasons for women having sexual pain when they come into you?
You know, in my clinic here in New Orleans, and even the people that I work with online, most of us are moms. So a lot of it has to do with something after birth, whether it was a C-section or an episiotomy or tear where they have some scar tissue and restriction. Sometimes it's, again, hormonal changes where they have dryness or they're on birth control and they also need some moisture and lubrication. And then another big one is just stress and anxiety and trauma. And I think as a mom running a business and raising kids for the past 2.5 years in a pandemic, that was stressful. That is kind of prolonged anxiety and stress that my body has gone through that I'm really working to unwind right now. So I think when we look at just kind of the world that we're living in and raising kids, I think our bodies tend to hang on to some of that tension that can, again, affect our pelvic floor and then affect our sexual health.
And I think that's interesting to think about. Our body holds on to the tension and the outside influences that are affecting us. Stress or beliefs about sex from our past.
Yes.
All these things can show up in our pelvic floor, in our body, in the tension that we have. And that can be so frustrating for women. They're like, there's so many reasons that can affect my pelvic floor.
That's a great thing we didn't bring up and we haven't really talked in depth about is the beliefs about sex. I think that when we are raised, we as just a collective society, no individual group, it's often that sex is bad, don't do it, this could happen, it's a sin, don't get pregnant. And then all of a sudden you reach a point in your life where you're like, oh, all of a sudden it's okay. Whether that's engagement, marriage, or relationship, sexual exploration, where it's really hard to unwind that narrative that you've been told over and over. So for a long time, you've told your body, no, 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 that's not good. And then all of a sudden you're supposed to be like, oh, okay, now it's okay. Again, our bodies do hold on to certain things. And so I think it's really hard to unwind that. And so much of the work we do is also working with psychotherapists or counselors or sex therapists to work on the social emotional aspect, because we really focus on the physical aspect, but they're so connected.
And I love that we can get that help from the outside of reframing, maybe working with some therapists, but also our body needs help to reframe and to relearn like, oh, I don't need to be tense. I don't need to be fearful of this or think it's bad. And that's where you come in helping do that. What are some of the things that you do to help women who are experiencing pain?
Some of the first things is just kind of educating them on their bodies. I think most people don't even know that there are muscles down here. So we have a pelvic model that will show them like, these are the muscles. These are how many holes you have. This is where things go into the vagina. what happens when muscles get tense, and just kind of helping them understand from an intellectual basis, nothing is wrong with you. This is a muscle spasm, just like I get a muscle spasm in my neck and I get a headache. And so kind of really just framing it in a very anatomical and physical way. I like to take an outside to inside approach. So I think of this like peeling layers of an onion from a very physical perspective. We may do massage work, or there's a technique called trigger point dry needling using acupuncture needles or cupping on their buttock muscles, on their low back, on their inner thigh muscles, and on their abdominal wall. Working through some of those outside layers of muscle tension, and then working more towards doing intravaginal work. So an intravaginal muscle assessment, it's almost like when you go to the gynecologist, but it's in a much more relaxed manner. There's no speculum. It's literally inserting my glove lubricated finger into the vaginal opening. And then I assess how much can you squeeze and do a Kegel? How much can you relax that Kegel? Because that relaxation is something we're really looking for. Do you have any muscle tension or tenderness within the vagina and throughout the pelvic floor? And if they do, that's when we start doing just gentle massage work internally. We prescribe vaginal dilators, which look like tampons of different sizes. Well, we'll have them use them in the clinic and then go home and practice with them at home so they can start working on inserting something larger and larger into the vagina comfortably.
And just trying to relax while they're inserting it. Is that kind of what you have them do?
Absolutely. So once they have it inserted, we always tell them like pain is a sign that something's not right. So don't push through pain. You always want to work in a comfortable range. And once you insert one of these vaginal dilators, typically people are lying down on their back in a relaxed manner. I'm like, don't watch Game of Thrones when you're doing it, like soft music, not stressful day, use a lubricant. And then once they have it inserted, maybe practice doing in and out movements with it. Practice opening and closing your thighs, stretching a little bit at the opening, teaching their muscles to stay relaxed when something's in the vagina. And then once one size is comfortable, then the next session, they move on to the next largest size. Once that's comfortable, they move on to the next largest size. I almost say it's like training for a race. You have to walk before you learn to run. So we're just teaching people the basic. How do you insert vagina and not tense up in response to it? Kind of retraining your brain to think this is a non-painful event, and then gradually increasing the diameter. And then if they're looking to have intercourse with a partner, how do you transition to having sex with a partner? Use the dilator immediately before intercourse. Maybe have your partner use it on you. Just different techniques to go from inserting a dilator to having sex.
And I love that too, thinking about how you use the dilators. If you've had sexual pain, do that with your partner too. Take it slow.
Right.
Don't push through the pain.
Absolutely.
Make sure you're okay, which I think so many women are like, nope, I just push through. And it's like, no.
I think as moms, that's kind of what we do, unfortunately. It's almost like this survival mode of like, I just got to get this done. But I think once we kind of start to pull away from that and think, okay, this is something I deserve to enjoy. This is something I deserve to spend time and energy on because it's for my pleasure as well. It's not just kind of a task that needs to be checked. Then I think we can really start doing the work to get there. But we get there at different times. It's nothing like if it's 6 weeks or 6 months, I'm like, we're here for you when you're ready. And when that time comes, then we'll start.
And that mind shift is huge to just realize it's for me. And this is a way for me to relax and feel pleasure and be taken care of too, not just to serve someone else again, as I've been doing all day.
Absolutely. Again, I know, which we do all day and all night, and year after year.
Right. Forever. And what are some of the things you do for people after birth who've had vaginal tearing or an episiotomy or scar tissue from a C-section? What are some things you can help with those types of after birth things?
So again, a lot of it's education. I think a lot of times we're afraid to touch these parts of our body. There's kind of a physical detachment we have and an emotional attachment. With respect to a cesarean scar, we really teach people how to kind of massage their scar, massage around their scar, start working directly on their scar so that it doesn't get stuck or tight or you develop that C-section shelf. Cesarean scar restriction can lead to bladder problems, constipation, painful intercourse, abdominal pain. So really working to keep that scar nice and soft. And then when it comes to perineal tears, we again teach them how to, just like we teach people before birth to do a perineal massage, we also teach them after, either using a dilator or their finger to kind of gently soften and stretch that scar. All of this is when scar is healed. So we're talking maybe 8 to 12 weeks after birth. But again, that's really the time we're coming out of the clouds anyway. And we're thinking, okay, now I can finally take care of myself a little bit. But even if you were years out from birth, decades, you can always still work on your scars. It's never too late. I do have a clinic here in New Orleans, but over the COVID time, when our clinic was closed down, I really started doing a lot more online stuff and developed this whole kind of painful sex series where walking people through how do you massage your scars? What stretches can you do that help with relaxation? How do you use vaginal dilators? I just feel like when you have kids, it's hard to make a doctor's appointment. So what can we do to help make this info accessible to moms so they can actually start making progress?
And I would love if you send me that link after the interview for that
Thank
series.
you. That would be
I'll
awesome.
link it in the show notes because yes, we need that. And like you said, sometimes it can be so hard to make that appointment, even though
I know the intentions
it.
are there, but like life happens. We totally get that.
And what are some things you would want to just say to women who are struggling with sexual pain?
And I don't want to sound preachy here. And I struggle with this so much as a mom and as a woman, but I'm like, you deserve this. I think we do serve so much of our families, and our body serves as a vehicle to create our families. And I think afterwards, it's really easy to just go into that mode where we're just trying to keep everybody else afloat and not take care of ourselves. And if you're experiencing pain of any kind, but particularly sexual pain, like there is help. This is not something that you just have to deal with. I'm turning 40 and I'm like, I have another, hopefully 40 years where I can be having sex. Like I want to enjoy that and I deserve that. Really taking the time out for yourself to explore these issues, I think can not just be physically healing, but also really emotionally healing.
And I think it can be so healing as your relationship too with your partner.
Totally.
And especially we have these views of like, I just need to serve my partner. They want to care for me too.
They do. A lot of this is just about connection. And so I think that you're so right. I mean, a lot of times this does cause friction in our relationships. And I think as moms or raising kids, there's enough reasons to have friction in our relationships. And for this to be one of them can just kind of naturally draw more of a wedge or more distance. And so oftentimes partners don't even know that women are experiencing this. So I think one, just having that conversation. I tell my husband, like, if you had this problem, I'd want to know and I'd want to help you. And so I think that they often feel that same way. Just having open, transparent conversations can actually draw you closer. You can get some of the support that you need, that you feel like you're not just figuring this out by yourself. And then eventually getting to the point where you are having enjoyable, pleasurable sex can be really healthy for your relationship. There's a lot of factors. And I think sometimes we're just in survival mode and can't see those, but it's healthy in a lot of ways.
Even just recently, I was having a conversation with my husband about something I was struggling with. And I was like, I'm so sorry. This is so hard. You shouldn't have to deal with this. And he's like, if this is something you're struggling with, I want to help carry that burden. In a loving relationship, that's how it's going to be. Our person is going to want to help us and be there for us.
Totally.
What are some tips you would give for women as they're working through sexual pain, but still having sexual encounters and activity with their partner? What are some tips you would give them to keep themselves safe from the pain, but also still be able to be intimate?
Sometimes intimacy can be literally just cuddling, holding hands, like touch, showering together. I think sometimes we think that we have to go from zero to sex, zero to penetration. And I always talk about outer course. There's so much that we can do that's just physical intimacy that doesn't include penis and vagina. There's outer course, physical touch. There's a lot that we can do to stay connected. So it doesn't have to be so black or white, like, well, we can't do it, so we just don't do anything at all.
Amen. I'm like, even going to the doctor after, it's like, wait, do you mean no sex or no sexual encounter or no intercourse, like
right. Like exactly. And I'm like, and again, and communicate with your partner. I mean, this is a practice in communication. If you're like, okay, this position's more comfortable, I want to start there. And we do need to use a lubricant. Let's start there. Or I need to use my dilators first. Let me do that. And it won't always be so mechanical, but I think we kind of have to practice. And I tell my son this all the time. He was going through something at school and I said, okay, I want you to practice saying this to me so that when it happens again, you know what to do. And he's like, why? I'm like, it's just like baseball. You have practice so that you're ready for the game. And I think sexual health too, you can do things to help you prepare so that when you are ready and it's not painful, you feel much more confident, much more comfortable in your body and how you're going to show up.
And you can go outside of what you've practiced too, now that you're comfortable. I love that. Can you just share a couple tips and kind of summarizing what we talked about for women who are experiencing sexual pain? Where should they start?
You can talk to your medical provider, whether that is a pelvic floor physical therapist, whether that's your OBGYN. you have to be your own advocate here, because I think some, again, medical providers and physicians will say, just use more lubricant or just relax or take anxiety medication. And it's so much more than that. I think if it was that easy, nobody would be experiencing, painful intercourse. You really have to be your own advocate and going to talk to your medical provider about it, talking to your partner about it as well. I think sometimes just leveling the playing field of, hey, this is where I'm at, takes away a lot of the shame, opens up the conversation, and it starts to be a conversation about a medical condition versus feeling like something's wrong with me and I'm defective. We have to have these conversations because we're going to have them with our kids and we want them to have them with their kids. And so I think just making this, like we're talking about back pain or headaches, it's a medical condition that needs to be addressed. And then I think start working with a pelvic floor PT or look into some of the online relaxation resources that are out there. It's not as scary as you think. We have so many people coming in or that I've worked with virtually that are like, okay, I was so nervous and this isn't that bad. It's really not. It's actually kind of relieving to go somewhere and say, hey, this is what's going on. And they're like, yep, we know exactly what can help. We see women all the time with this. Let's start with A, B, and C.
You're not broken.
You're not broken.
Your fault. You don't have to push through.
Right. I mean, I've worked with hundreds of women and they're like, really? And I'm like, absolutely. And so again, I feel honored that they're willing to trust me with their care. So like, we want to help you pursuing pelvic floor PT, starting some of these online things. And it can be simple. It can be easy. And you may be able to do some at home. And then eventually you may need to see somebody in person.
Which is so great to have both those resources and kind of knowing where to start. And where can we find you, Sara? Working with you virtually if they're not in your area and your resources.
So as you mentioned before, I'm on Instagram. My handle is the.vagina.whisper. So the vagina whisper. And it's
I love it.
Probably too much information, but I find it just really fun to be able to educate people about different parts of their body and, pregnancy and postpartum in a really kind of lighthearted way. And then my website is thevaginawhisper.com, where we have a ton of blog posts about like painful sex and lubricants and postpartum recovery. And then also I have an online membership platform that has a relaxation series specifically focused on painful sex to walk you through how to use dilators and stretches to do and how to sit properly and pee properly and poop properly. So kind of looking at your whole day and your whole life of where can I really start making some changes right away as I'm still working through relaxing my muscles and tissues.
And they have so many awesome topics like working out during pregnancy and like just all the things. So definitely check out the blog.
Thank you.
Blog.
Thank you.
And what would you say to people who maybe need to see someone in person? Like you said, especially as moms, especially when we're busy in life, it's just so hard to find someone. What are some tips of finding a good pelvic floor physical therapist?
So I would say there's probably 3 things I would do. I would reach out to your OBGYN or gynecologist to say, hey, I think I need pelvic floor therapy. Is there someone you would recommend? I would ask your friends. You'd be surprised. Your mom friends, your girlfriends, a local mom's blog, just post it up there and you'll get a ton of recommendations. You can just do a quick Google search in your area. And then there's also a website called pelvicrehab.com. And this is strictly like a pelvic PT locator. So it's only pelvic floor therapists on there. And you just type in your zip code and it pops up who is on there. And then you can vet those recommendations you get. Your pelvic floor therapist should do internal work. If you're going to see somebody for painful sex and they don't do an internal assessment or they didn't talk about it, I would say they're probably just a general physical therapist who's trying to do this a little bit, but really not a specialist in the area. And you really want to find a specialist.
Which the first time I went to one, I was like, oh, I'm getting naked. I didn't realize that, but it's so important because they need to feel the muscles in your pelvic floor. And
people will be like, what do I wear? I'm like, oh, you're not going to wear anything. So you're normally lying down on your back and you've got a sheet covering your bottom. So you can still have your top and your bra on, but over your lap, you've got a sheet covering you. And then they keep you covered until they do the pelvic assessment. And so just to kind of get the information from the muscles. And so there's a lot we do externally, but depending on the level of muscle tension and pain, we may do an internal assessment. But if you're having somebody just, have you do a bunch of crunches and bridges and they're saying it's going to help painful sex, that's not the type of therapy you want to be doing.
Yeah, which is so good to know, because if you go and they're not looking, like doing internal vaginal assessments, you're like, okay,
Right.
this isn't the right place. Before we close up, do you have anything else that you want to add?
I think it's so amazing that you are bringing up these topics that are kind of hard to talk about, that we don't always think to talk about when we think about sexual health or intimacy. And so I'm just really appreciative of you having me on and sharing this with your audience. If it just helps one person, I just feel like that the ripples of that go so far. So thank you.
Thank you so much. This has been great, Sara. Thanks for coming on.
Thank you.
I definitely wish that I had known about pelvic floor therapy earlier in my life. But even so, even though I know now, I still find myself, like Sara was talking about, sometimes not taking the time to take care of myself. So I hope that if you struggle with painful sex, or you have in the past, or maybe you've had a baby and you want to go get checked out, maybe you're having trouble leaking pee when you jump or exercise, that there is help for us. And as women, I think it's so important that we need to start to take better care of ourselves, to show our kids and our families that we're a whole person and that we deserve to be taken care of. And this topic is really important to me because I see sex as something so important to bring couples together and to enhance our relationship. And it's so sad to me that if I ever experienced any type of discomfort or pain during sex, instead of thinking, oh, stop, figure out what's going on. Maybe we need a different position. Maybe I'm a little tender today, or maybe you need more lube, or whatever it is. And I've had a couple of friends talk with me that they didn't realize that intercourse wasn't supposed to be painful, or they had an experience where they weren't feeling pain and realized, wow, this is not painful. And as women, it's so important to understand that what we feel matters. And when I say it like that, it's like, duh, Ariel, of course it does. But I think a lot of us don't value what we feel and what we're experiencing. And in a healthy relationship, a partner wouldn't want to hurt us. They would want us to speak up and let them know what we're feeling and what we need, or what is making us uncomfortable. So let's just blow this out of the water once and for all. Tell all your friends and neighbors that intercourse should not be painful for women. And if it is, it's time to get help. I hope that this episode was helpful for you, and that if you want to go visit a pelvic floor therapist, that you have some resources to look at beforehand, or do some online things, or just know how to find one who is practicing near you. As always, thanks for talking love.
Thank you to all of you who listen and join me on this journey, and to our Ladies Talking Love team who make the podcast possible. Thanks to our sound wizard, Brett Hansey, our newsletter guru, Lauren Barton, and our miscellaneous task whiz, Jana Norman. As always, thanks for talking love.